apart from that, your station was good, but because we were doing cardiovascular stations, so one important test that you should mention in all your stations, and you did not mention, that was you
Was?
troponin special test for like you can say special uh, test for heart enzymes to the patient.
All
Troponin, you
right.
did not mention troponin in,
Okay.
not in first station, not in second station, and then in the fourth station as well, because that was also a kind of history taking station. So in these three stations you are ruling out
Yes.
cardiac causes, right? So how can you rule out
Okay.
of that?
Okay. Uh,
All right.
okay.
So in this station, basically, Saima, your data gathering was good, but I think instead of asking about lifestyle questions, you should have started your management earlier on. Like you started your management after 6 minutes.
Yeah.
Instead of that, try to start your management by 5 minutes.
Okay.
Okay. And then when patient, because you were not having
Mhm.
enough time, basically this station was patient was refusing admission to the hospital. Okay, so you had to like
Mhm.
convince him. And also the second part was, if you
Mhm.
see at your task, discuss your plan of management with him. So basically in that station you did not mention
Mhm.
anything about the management, because
Mhm.
patient was telling you that I don't want to go to hospital, and you were stuck over there, and then time
Mhm.
finished.
Yes.
Okay, so it is better to start your management earlier on. So if you are getting anything like this, and when you have to convince the patient, you have to tell the management plan, you can easily tackle that issue as well in the management.
Okay. Okay.
So how will okay, let's talk about this station now. So I'm saying I don't want to go to hospital because my father died there. What will be your response?
Um, oh, James, so sorry to hear that. My deepest condolences are your father. But the thing is that right now you're having this chest pain that seems to be quite serious. You need immediate treatment for that. You have to go to the hospital, otherwise your condition get worsen.
But doctor, I don't want to go to hospital. Cannot you give me any medication here?
Well, we can give you some medications for to relieve your pain, but that would be a transient symptomatic management. For having proper investigations to know the cause of of your chest pain and to get proper treatment, I'm afraid that you have to go to the hospital because they might uh, refer you to the specialist there for the management.
Oh, doctor, you are not getting me. My father died there, so I don't want to die like him in the hospital. I know many people who went to hospital and then they died. I just don't want that to happen.
Well, I can understand that you are really concerned, but don't worry. Well, there are a lot of people who go to the hospital and they get better and they come back home safe and healthy. So I hope the best for you. And right now, you're by immediate treatment to your problem, you can get better.
Mm, but doctor, cannot can you give me something here? You know, this is a clinic. You must be having some medication here.
Well, I will for right now here. I will give you a pain for pain management. I will give you a medication under your tongue. All right, and I will also give you aspirin, and we will also give you oxygen. That will relieve your pain, and for just for a while. Okay, once you are, but it's not definitive treatment.
Okay,
All
okay,
right.
okay, okay, Saima.
So.
Do you remember the
Mhm.
history? Did you ask me, am I still in pain?
Yes, I asked you, is it comfortable for you to talk right now? But I didn't ask, am I still in pain?
Because I told you I had chest pain yesterday, which got better
Mhm.
in 15 minutes. So are you sure I am having pain right now or not?
Okay, okay.
Okay. So
Right.
that was episodic pain, right? He was having
Yes.
episodic pain.
Uh,
So you could have asked
without.
me, when you are dealing with episodic pain, there is,
Mhm.
okay, all these questions are important. But for episodic pain, remember this mnemonic in your mind: FDT. F is for
Mhm.
frequency, D is for duration, and T is the timing. Like how many episodes you had. Okay, if he's telling you I'm having this pain for past 6 months, so ask him about the
Uh-huh.
recent episode, the duration of that episode, and timing and trigger. Obviously the it will cover in Socrates, but at least you should know how long that lasted. Okay. And
Okay.
I told you that my episode was yesterday. So because so you next question you can ask me, are you still in pain?
Okay. Okay.
Okay, because patient was not having pain right now.
Mhm.
Patient was having pain yesterday, but he came to the hospital today. So GTN and all the active treatment options will not work here because he's not in pain.
Yes.
So basically what you need to do here is you need to refer him to the hospital, first of all for troponins. Okay, because you are suspecting NSTEMI. The ECG was normal. If you are not having ECG finding, then obviously you can, if pain is gone and ECG was normal, ECG was not normal, it was not given in your task, then you can think about NSTEMI. But if ECG is normal, then you can think about unstable angina, right? And for both
Yes.
these reasons, you need cardiac troponins, and that will be high most probably. You want this patient to go to hospital so that we can do cardiac troponin. We want this patient to go to the hospital because he is a kind of high risk patient. He is telling you recent worsening of his symptoms. His last episode lasted for 15 minutes. Okay, progression was there. Furthermore, his BP was high, so he's not in regular checkup, but still he was having high BP, so he might not be aware that he is having hypertension. He's a kind of high risk patient. So we want him to go to the hospital right now so that we can treat him effectively. And in the management, even if the patient is insisting, I don't want to go to the hospital, try to negotiate with him, but side by side, tell your management plan as well, what you will do in the hospital. All
Mhm.
right. So,
Okay.
what will be your
I
management plan? Hello?
I said I just forgot cardiac enzymes everywhere.
Yeah. You are dealing with chest pain. So in chest pain, if you don't talk about cardiac enzyme, you obviously you are in trouble because you cannot rule out. Uh, okay, cardiac enzymes can be negative right now because they take some time, but still, to be a safe doctor, you need to mention that.
Okay.
Okay. And then
Okay.
in hospital treatment for that person, you can give him aspirin there and then in your GP clinic. Okay. So for the time being, you can give him aspirin, and after that you want him to go to the hospital. You can even, if he is mentioning problem with the transport, you can even offer him arrangement of the ambulance service as well. In the hospital, they will give him some blood thinning medication. They will think about some surgical
All right.
options because he's high risk, so he might be a candidate for cabbage
Okay.
or PCI. In hospital, they will decide
All right.
after further tests, like echo, they might do stress testing. So they will decide what kind of treatment he will be needing. But tell about the options as a junior doctor.
Okay.
And that's how you will deal with this station. Or any station when patient is mentioning episodic pain, make sure, is he having any pain right now? If you are dealing with chest pain, similarly in urticaria station, because that is also episodic, so make sure he is having rash right now or not.
Okay.
Okay, so when patient is telling you a symptom which is not continuous, so be very careful about that.
Okay.
All right, so let's talk about next station. Next station was pulmonary embolism in transgender. Your history taking was good. You ruled out important DDs. You asked me about calf pain. Everything was there. In the examination, patient was having low oxygen saturation. Okay, I told you it's 88.
Yes.
And furthermore, uh, because when you are dealing with breathing difficulty, so it is good to do cardiac enzyme. It is good to do ABGs as well.
Okay.
And you can even talk about D dimers. D dimer you can talk here, or if patient is high risk, then we don't do D dimer, we directly do CTPA. So it is optional. But talk about ABGs, talk about chest X-ray, talk about ECG, cardiac enzymes, and routine bloods.
Okay. I
And then,
mentioned CTPA management.
yeah, you mentioned that. Yeah. Okay. So patient was telling you about HIT, but you have not uh, told her in the management that he need to stop HIT right now because that may be the cause of her pulmonary embolism, blood clot.
Yes.
Hmm? And
Yes.
everything else was fine. You give uh, symptomatic treatment first, then you talked about the specific treatment. That was good. You forgot about this HRT. So you are telling patient that I'm afraid we need to stop your hormonal therapy right now because that might be the reason for your chest pain. The patient is telling you, no doctor, I'm in the middle of transition, I cannot stop right now. Your answer.
Mhm. Okay.
Okay, and one more question, Saima. Sexual history was not needed in this station. Be very careful with sexual history, when you need to ask and when you don't need to ask. When you are dealing with HIV station, okay, when HIV is your DD or any STI is your DD, then ask sexual history. Like if you are dealing with any lump, any discharge in the private part, these kind of things. Otherwise,
Mm-hmm.
if you are dealing with sexually transmitted infection, ask sexual history. Otherwise, in the transgender, especially in this station, when you are dealing with patient in A&E, there is no need to ask about sexual history. In
All
A&E,
right.
it even if you are not asking about DESA, it's totally fine. And if you it is not very relevant to your diagnosis, or if you think you have time, you can ask. If you think you are not left with much time, you can even skip DESA as well.
Okay.
Whatever you are asking should be about the risk factors of that condition. If you have gathered enough risk factor, then move to the management.
Okay. All right.
Okay. And then, okay, I was asking you a question. Patient is telling you, doctor, I don't want to stop hormone therapy because I am in the middle of transition. How will you answer?
Olivia, I can understand your concern, but the thing is that right now you are having a problem that can be life-threatening. So we have to transiently stop this medication. The outcome of the condition is very good, and once you are stable and you are out of danger, we can review and about starting this again. So don't worry about it.
Yeah, correct. Good approach. But one more way of saying that is, you can tell the patient, I know this hormone therapy is very important to you right now, but your health
Mhm.
and life is our priority. So after we are done with the treatment and it is safe for you to start the treatment again, we will guide you regarding that, and we will supervise your gender transition. We have many facilities available for that, and we will get you in touch with those.
Okay.
So basically, we are telling him to go for supervised gender transition instead of trying over the counter hormones, etc. Okay.
Okay.
Okay. So sometimes he is taking pills, estrogen pills. I told you about injections. So sometimes he's taking estrogen pills. So in that case, the safest option can be transdermal estrogen instead of oral. Like you can tell him that we can think about some alternative options as well. But if you are telling about like supervised transition, referring him to the specialized clinic, then obviously you are safe. But if he's asking, then you should know the answer. Like we have alternative ways as well, alternative route of giving hormones as well. Okay. So if you have time at the end of the station, last 30 seconds, how will you close your station?
This okay. This pulmonary embolism station.
Yeah.
All right. So, Olivia, right now, I have told him about the medications.
You have
About
told
the
him,
treatment.
yeah. You have told him that you are going to admit him. You have told him that you will give him medication, like initial treatment plan. You have given him. Okay. Now you have 30 seconds.
All right. Olivia, if afterwards, if when you are stable, you have to be regular with your follow-ups. We will refer you to special clinic for safe and supervised transition, and you might have to take a few blood thinners for a long time. And please be regular with the follow-ups. If you have any similar chest pain, any shortness of breath in the future, please call 999 and come back to us immediately.
Yeah, correct. So if you have time at the end, it's not mandatory, but if you have time at the end, you can give him after discharge advice as well. If you have time. Otherwise, it's not mandatory.
Okay.
All right. So good. Next station was this one. Patient was diabetic, patient was hypertensive, patient was here for a follow-up. So you are basically doing a follow-up. Okay. This follow-up can be for any condition. It can be for hypertension, it can be for diabetes, it can be for epilepsy. So basically you will be having same approach in all these stations, follow-up approach. So first of all, you will ask him how he was diagnosed with the condition, what medication he is on, is he regular with the medication, ask about compliance. So if he is not compliant, then look for the cause and ask him why he thinks so, that this medication is giving the side effect. Like I told you that because I was using other medication for a long time and I recently started this medication, so it is the reason of this side effect, swelling. Okay. And that was really good that you asked me about the other causes of swelling as well. You ruled out DVT. That was really good. I liked it. And everything was fine. So you were having actually the problem in management. In the management, before starting the management, as patient already told you, so you could have used that as you mentioned that this medication might be the problem of your swelling, but still, we want your blood pressure to be under control. We found your BP 160 by 100, which is quite high. So I would involve my senior. We can think about alternative medication right now for you.
I forgot dry cough by complication while doing.
Yeah. So alternative medication was ACE, right? So don't forget cough. Don't forget postural hypotension when you are dealing with the ACEI.
Okay.
Okay. And rest of the things you can use GIT upset. You can use it everywhere.
Okay.
Similarly, yeah, postural hypotension and dry cough are very important. So don't forget those symptoms. Okay. Similarly, this station can, once you have told him about the side effect of the next medication, advise him to not stop the medication. If he is worried about side effect, talk to us, because we have many other options available to treat hypertension.
Okay.
In safety
All
netting,
right.
at the end, not at the end, in between your management, cover your safety netting points as well.
All right.
Okay, so this station can come as ACEI side effect as well. So patient is coming with dry cough. So in that station, what will you do, Saima?
AC inhibitors may dry cough, then we will the similar. We will say that we will review your medications after discussion with the seniors, and
Yes.
once you might be started on another group of medications called calcium channel blockers, but till then, please do not stop your medication. Um, and in any case, you if you have any problem like chest pain or shortness of breath, please call 999 or come back to us.
Hmm.
Um, he might ask about how a doctor does that. Is that drug is safe? Well, like any other medication, that medication can also have certain side effects. For example, swelling of your ankles. But don't worry, we will keep monitoring you, and in case you have any problem, we will treat it as per required.
Yeah, correct. That's the correct way of dealing that. But when patient is having side effects of ACEI, so we will not go for CCB, we will go for ARP first.
Okay.
Okay, so do you remember the less than 55, what we give in less than 55 years of age?
AC inhibitors.
Yeah. And if more than 55, or patient is Afro Caribbean, I think, or Asian,
Yes,
Asian, I
yes.
think. Black.
Afro-Caribbean. Afro-Caribbean, then we give calcium channel blockers.
Yeah, yeah. So this patient is borderline, so you can give both. But I think it's better to give him ARB.
Okay. All right. And the one thing that I had noticed in this station was that I didn't talk about any lifestyle modification. That was also important, but I didn't have time for that. But I didn't mention this word lifestyle modifications also. I should have mentioned that.
Yeah, just mention in a single line, or when you are asking question about about DESA, at that time you can mention, I need to talk about, say if smoking was positive, then you can say, well, I will talk to you about that as well. Okay, acknowledge
Okay.
that thing and tell her that you want to talk to him about that. And then in the management, if you are not having time, then still I think it's better than saying nothing about it.
All right. All right. Okay.
Okay. Uh, so in this Ramipril case, the next was Ramipril one. No, next one was this.
Remember-
So first talk about this one. Okay. So patient was
Okay.
on Ramipril. Ramipril is not safe in pregnancy because we want patient to. He is not pregnant yet, right?
Mm-hmm.
She is trying for
Yes.
1 year, and she is not pregnant yet. She
Mm-hmm.
And furthermore, if she is trying for 1 year, then this is not infertility or subfertility. 2 years,
Mm-hmm.
after 2 years, it is fertility. So she's telling you, I'm trying for 1 year, so you can give her some options. Okay,
Okay.
Simon?
Okay.
Let's talk about this station systematically. First, history. So in history, your data gathering part was fine. You talked to her about uh, this condition, like she was having that hypertension. After that, okay, one question you missed. Any other medication apart from this? So any other medication, we are looking for folic acid. If she is not on folic acid, we can advise her about folic acid
Okay. Okay.
in the management. Similarly, ask for allergies as well. And then you
Okay.
asked me about partner. So
Mhm.
when you ask me about partner, no need to ask sexual history in detail. Just ask about frequency of sexual activity, and
Okay.
also ask her if she aware of ovulation window or not.
Okay.
Okay, in data gathering part, cover these points. Or if you have not covered in data gathering, then also that is fine. Sometimes you forget. In the management, you need to cover these points. Ask her and then tell
Okay.
her that ovulation window is basically the time around your in the second week of your menstrual cycle. You are more fertile and there are more chances to conceive in that time.
All right.
And if she asks you, sometimes she asks you about the frequency of sexual intercourse, then I think it is 3 times per week.
Okay.
Okay, so that's the extra point you need to cover in the management. You will do your management. First of all, tell her that I am start your management by, okay, so you found the BP was not high. Tell her that we, as you know, we examined you, and the good thing is your BP is controlled. But right now you told me you are trying to get pregnant. So I would talk to my senior, because we would like you to be on an other kind of medication which is safe in pregnancy. This Remipril is not
Mhm.
causing miscarriage or anything. Just it's not safe in pregnancy. So that's why we are changing it. Okay.
Okay. Okay.
So it's not the reason of her not conceiving.
Okay.
So you told me that you have been trying for 1 year. So there are few tips, or there are few advices I would like to give you about that. If these are not working, we might need to refer you to the fertility clinic for further options.
Okay.
So you can talk about folic acid. You can give her vitamins, like tell her about well
Multivitamins.
balanced diet. Okay, tell her about well
Mm-hmm.
balanced diet. She told you I am on well balanced diet. So if there is any risk,
Mm-hmm.
smoking positive, alcohol positive, you can advise about lifestyle. And
Mm-hmm.
you can talk to her about this frequency of sexual intercourse and ovulation window. Tell her about that as well.
Okay.
So you will do these 3-4 things in all the stations when patient is here for preconception counseling. There are other stations as well. Patient is trying to
Okay.
conceive. Then you need to cover folic acid. You need to cover lifestyle, well balanced diet, uh, um, good physical activity, no smoking, no alcohol. Third thing should be this frequency of sexual activity and ovulation window.
Okay.
And if time duration is more, she has been trying for say 4 years or 3 years. She has never been. You asked about acne and PCO things. That was really good. And if
Uh-huh.
time duration is more, then you can refer her to fertility clinic as well.
Okay. Okay.
Is this station clear so far?
Yes, it is.
Okay. And in the examination, do mention about BMI as well.
Okay. Okay.
When you are mentioning your examination, Saima, always start from vitals, okay? Blood pressure, heart rate,
Okay.
breathing rate, and then talk about general physical and specific examination.
Okay. Okay.
Okay. Then another station was about this patient was on follow-up, patient was having post-herpetic neuralgia, right? Did you
Mm-hmm.
ask me about vesicles? Are you having vesicles now?
I asked you, are you having any rash? And what is it, this chest pain at the same place where you had rash?
Yes, that was a good
Not
question.
particularly.
Yeah, that was a
Uh-huh.
good question, but that which place? You did not ask me about site.
Uh,